Guys, let's talk about pellets. This talk is all about one of the modalities that we use at PATH to administer hormone replacement therapy. So we're going to talk about that methodology today, but we're also going to talk about why you might want to consider pellets. And so it's an overview of the reasons why you want to consider bioidentical hormone replacement therapy in the first place. So let's start with that. Uh-oh. All right. So just as a reminder, I'm Dr. Nicole Puples. I'm a board certified physician in internal medicine, and I focus on hormones and longevity. But I've also been trained outside of my conventional medical training in functional medicine, as well as the American Academy of Anti-Aging Medicine, as well as a certified Avexipel provider. And Avexipel is the brand of pellets that I use. And so we're going to talk specifically about pellets, but we're also going to talk specifically about Avexipel and what makes Avexipel different than some of the other brands out there, because there are quite a few options out there for pellets, but I may be a little bit biased, but Avexipel, in my opinion, is one of the best. And when we talk about the types of hormones that are provided through Avexipel, it comes from one of the only FDA approved compounding pharmacies out there. So it makes a big difference. And if you don't know what any of that means, don't worry, we're going to cover it today. So the thing that happens mostly in our office is that women will come in and they will say everything, all of their symptoms, anywhere from gaining weight to feeling overwhelmed and pain and joint pain, frustration, moodiness, hot flashes. They'll have all of these symptoms, but all of their labs will look normal. And this is a very common occurrence because oftentimes most doctors don't know what to look for when they're thinking about whether a person needs hormones or not. And so the first question that you want to ask yourself before you even consider the modality of hormones is, how do you feel? And this really plays a bigger role in your overall symptoms or in your overall treatment than anything, even your labs. The labs play a part, but your symptoms do as well. So the first thing I would ask anybody is to really do an assessment. And I will walk you through some of the symptoms that people might come to get pellets for. And I'll give you some examples for both men and women. So you can figure out whether or not this is even something you should be considering. So the first one is the one that most people think of. So we think about hot flashes. I don't know if any of you guys saw this video, this viral video that went live where a woman was sitting outside in the cold. And I don't know if you can see in here, I'm going to actually blow it up because it's really too funny. I mean, you can see the steam coming off of her head. This is, Google it if you haven't seen it. It's really hilarious. The other one is night sweats. So this is very common for women who are in their late perimenopause or early menopausal state. They'll have hot flashes and is a common reason to consider pellets. So the other is bloating or belly fat. So oftentimes when women and men, so when women are going through perimenopause or men are going through andropause, we'll see that we have this accumulation of fat around our bellies. That muffin top that doesn't seem to go away, you're doing all the same things, but you're not able to get rid of this extra fat. So this is a very common reason. So then there's brain fog and fatigue. Again, this happens for both men and women. When I was putting this presentation together, I wanted to be clear that even though we talk a lot about perimenopause and menopause, that these symptoms also happen for men. And so if you have a male in your life, a father, a brother, a significant other, really start to look for symptoms in them as well, because again, you don't want to be the only one treated here, and pellets are a great option for men as well. So anxiety and overwhelm, also very common symptoms that we see in menopause, perimenopause, and andropause. Loss of motivation and depression. So this is a very common one. I don't know if anybody's heard Halle Berry talk about this, or it's been actually in a lot of news where people talk about when women go through menopause and when men go through andropause, we'll see this depression or anxiety, loss of motivation that is oftentimes assumed to be depression of the ordinary variety, not something that's driven by hormonal imbalances. And so it's important, if you haven't had any of these issues your whole entire life, you get to your mid to late 30s or early 40s and these become issues, then it may be your hormones. Oftentimes I'll say you definitely want to check your hormones in that case. Also, moodiness. Again, this is something that we oftentimes assume is just something that happens with women, but we also see it in men. So really important, if these are symptoms, again, these are great reasons to consider pellets. Pain with sex or discomfort with sex, no desire. This is another great area. We're going to talk specifically why pellets are so great in this area. But again, these are other symptoms that may be of concern. And then hair thinning or even dry and itchy skin. I think one of the most hidden causes or symptoms of perimenopause and menopause is this itchy skin that just seems itchy ears, just itching all over. It's a weird symptom, but it's very common. So why is all of this happening? So in women, we naturally are going to decrease the amount of estrogen. This slide only shows estrogen, but it's not just estrogen that's declining. We see a decline in both estrogen, progesterone, and testosterone all as we get older. And we see something very similar in men with testosterone. There's a decrease in testosterone as people get older. And this decline is inevitable. There's nothing you can do about that. It's a part of aging. As you get older, that is a normal, expected thing. And so then the question becomes, what can I do about this if it's going to happen inevitably? I want to take just one more second to point out again that this happens in both men and women. And you can see there's some overlap between our symptoms. We went through some of them: mood swings, depression, headaches, night sweats, insomnia, weight gain, and bone loss. But then there are some that are very specific to women, things like hot flashes and heart palpitations. That can happen really in both men and women, but we see it more common in women. Vaginal dryness, achy joints, and muscle discomfort. And in men, a big one is also going to be decreased motivation, lack of focus, low energy. Again, can be seen in women, but oftentimes these are some of those hidden symptoms of andropause, and really a decrease in muscle mass. And we've all seen it. If we just take a moment to look at the people around us as they get older, you can see some of the impacts of this decline in hormones, particularly around muscle mass and bone mass, and just people shrinking in size. All of these things are a part of this loss of hormones. So it leads us to, what can we do about this? Is there anything to be done? Is this just a normal thing that happens with aging that we just have to accept? And the answer to that is no. This is why I do all of these talks, is because I want people to know that there is something you can do. So what would you consider doing at this time? That's the whole point. We're going to talk about this idea of bioidentical hormone replacement therapy. And bioidentical hormone replacement therapy is the type of hormone that you get when you do a pellet. All of the hormones given by a pellet are bioidentical. So let's talk a little bit about what that means. So all that means is that the hormones that we give through pellet therapy are identical to the hormones that your body naturally makes. This is different than like a synthetic hormone that you might get in a birth control pill or in some of the synthetic menopausal hormones or andropause hormones. The difference is that when the structure looks identical to the hormone that you make in your body, the effect is also identical. So all of the things that our hormones naturally do for us that keep us really healthy, those are what we're replacing. There's no need to replace hormones that your body isn't familiar with. And so that's really important, and to understand that when we're doing pellets, we're giving bioidentical hormones. And then it's really about restoring balance. It's not really about giving you the same hormone that you had when you were 20 or so, but it's really about giving you enough balance so that you're symptom-free. So when we talk about getting hormones, I tell you that you get these bioidentical hormones in pellets, but there are other ways that you can get bioidentical hormones. You can get them in forms of pills, creams, gels, and pellets. So I'm going to go over all of them and then tell you why I prefer pellets over some of the other ones. As we talk about the different modalities, in this sort of diagram, I'm going through the types of hormones that come in these forms. So not every hormone comes in every modality. So when we talk about pills, you can get just about all of the hormones as a pill. I don't recommend giving all the hormones as a pill, but they do come as a pill. So you can get your bioidentical estradiol, progesterone, thyroid hormone, vitamin D, which is in fact a hormone, and DHEA, all as pills. And I don't recommend, out of all of this list, I don't recommend you doing estrogen via pills because it has more side effects. You can do creams or gels, and the ones listed here. You can use patches, and patches really only are available with estradiol. There are also rapidly dissolving tablets that go underneath the tongue. They look like little jelly beans, but that absorb underneath the tongue. And then there's also injections that you can do with testosterone. And then when we get to pellets, we're talking specifically about estradiol and testosterone. You don't really do many of the other hormones. I know in some places you can do DHEA as a pellet, but most places and what we do in our practice is really estradiol and testosterone. And so when we look at all of these options, understand that most of these, all except for the injections, can be done as bioidentical. But why would you choose pellets over some of the other ones? And there's several reasons, but one of the big reasons is the levels that you get and the stability of those levels. So the great thing about pellets, and actually let me just go back and highlight this picture. So what exactly is a pellet? It's way over here in this bottom right-hand corner. You can see the really small one that looks like a Tic Tac. That's an estrogen pellet, and the larger one that's cylindrical. That's a testosterone pellet. And so these are hormones that actually are put into underneath your fat tissue through a small procedure, and it gets absorbed into your body naturally over time. And what you'll see is that if we look at the pellet in the, I guess this is like a lime green, you'll see that what happens over time is that the hormones get elevated into your body, the hormone levels elevate, and then they stay stable over a period of time. This is really the reason why I love pellets. It's because you get a stable amount of hormone over a period of time. And pellets can last you anywhere from 3 to 4 months as a woman and up to 6 months as a man. So you get these steady levels over the course of time. But if you look and compare that to things like injections, you'll get these high peaks of levels, but you'll see this sort of roller coaster that with injections and creams and even oral medications. When you first apply these medications, either through an injection or as oral or a cream, you'll get this boost. And then it just dies out over the course of the day or the course of the week, and then you have to reapply. You can see here, I think this picture is 1,000 words, but you can see where you get this steady state with pellets that you don't necessarily see with some of the other modalities. The other thing is that you're really getting up to optimal levels of hormones. And what I mean by that is symptom control. So it's one of the best modalities to actually address the symptoms that people are complaining of, those symptoms that we talked about earlier. Pellets do an excellent job of addressing all of those symptoms in one way or the other. So some of the benefits of pellets, we've described that you get a sustained hormone level, but here's another really, and this is actually, even though I love the idea that you're getting the sustained hormone level, the reason why I actually take pellets over creams for myself is that it's convenient. Like I said, you can put in a pellet and it will last you anywhere from 3 to 4 months as a woman, and you don't have to think about it. When you think about doing creams, that's something that you apply every single day. If you're talking about a patch, you've got to apply that at least twice a week. And if we're talking about injections, that's either once or twice a week. So again, the convenience of pellets are amazing. And then minimal side effects. One of the reasons we don't see as big a side effects with pellets is because of that steady release of hormone instead of that fluctuation that can cause more side effects. And then it's, as I described, there's a consistent absorption. So you're getting the same amount over a consistent period of time as opposed to that up and down. And then again, you get really improved quality of life with these doses of hormones being at a consistent level. So really some great benefits of hormones as you see there. So how are pellets even placed? So I'm going to show you a little image and hopefully it will make a little bit of sense. But let's just say that this is your skin at the top. That's what this is depicting. And we use a small device. We put a really small incision in under anesthesia. It's nearly painless. And we insert the pellets into the fat tissue. And that's where it gets absorbed and brought into your bloodstream. And that's where you get this steady state. And over the course of, like I said, 3 to 6 months, you're going to absorb that pellet into your system at a steady rate through your fat. And you don't have to even think about it after it's placed. So this is essentially what this procedure looks like, and it literally takes about 10 minutes and is always a surprise to my patients when I put it in for the first time. They're expecting some sort of extravagant pain, but there is none. Who should consider pellet therapy? The real question goes back to the first one we asked. Are you symptomatic? If you're a woman and you have any of those symptoms that we discussed in the very beginning, then you should really consider pellets. It's not as if there is any major reasons why, if you're considering hormone replacement therapy, why pellets wouldn't be on that list. The biggest concern about pellets is that it is a small procedure. And so if you are not interested in having a procedure that takes about 10 minutes and it's painless, and some people aren't, right? And if that's the case, then you may want to consider another modality. But for the most part, if you're having any of the symptoms that we discussed as a woman or as a man, right? This is one of those procedures that can be done in either one, either male or female. And it's really great for men, particularly because with men, we're giving just testosterone. And typically, this is the version that I only do in men. I really don't like the injections for men. That would be their other option. Absolutely don't like creams for men. So pellets are really going to be your only modality that we do at Path for men. Women, we consider doing creams and patches when it's appropriate if people aren't interested in doing pellets. So the one thing that I just realized that I don't have a slide in here, so I'll just come on screen, is to talk about reasons why a patient might come in for hormones. And we talk about the options between creams, patches, and pellets, why somebody might decide they didn't want to do pellets, other than just, I don't want to do a procedure. And that is a case. So some of the concerns around pellets are that once you place the pellet, you can't take it out, right? So if the dose is too high or it's too low, what do you do then? So if the dose is too low, after about 6 weeks of the pellets being put in, if your symptoms aren't resolving to the standard that we would want them to, we do two things. We get some labs, we talk about your symptoms, and we decide, is the symptom that you're having related to the dose of the pellet that we put in? Do we need to add some more? Is maybe we need to add a little bit, what we call a boost, or is maybe the symptom related to something else and we need to address that other thing? That's the first step that we take if the levels are too low and you've got a pellet in. Now, what do we do if the pellet dose is too high? Now, how do we know if it's too high? Number one, we can take a look at your labs, and maybe if your blood levels are way too high, we may say, oh, we need to back off. But usually in that case, we just wait for the pellet to absorb. And like I said, it can take anywhere from 3 to 4 months. But if you're asymptomatic, it's not that big of a deal. But what if you do have symptoms? So what type of symptoms might come? And these symptoms I'm going to describe right now are the same symptoms that you would have whether or not it was a pellet, a cream, or anything, or any other modality, but things to consider. So if you develop, one of the major concerns is always going to be something like acne. So again, with testosterone, when we're giving testosterone through a pellet and you develop acne, again, we can't take the pellet out. And so what do? We typically will give you a medication that helps to block the development of acne. And that medication is called spironolactone. And we'll do that to bide our time until that pellet wears down, and then we'll give you a lower dose at your next pellet. Another common concern might be hair thinning or hair growth. So those are two separate things that on the two separate sides of the same coin. So hair thinning usually happens because you have been without hormones for a while. Some of those hair follicles actually die off, but they're still in your head. And then we flood your body with all these hormones, and your body is, oh, all these hormones started to develop, and you may have a little bit of hair loss in the very beginning, right before the hair starts to grow back. The other thing that may happen is that it may reveal some other issues like thyroid disorders. So in that case, then we just have to look at the causes of that and treat the thyroid. So those are some things that may happen. Hair growth can happen oftentimes in women in places you really wouldn't want them. So things like around your chin or on your chest. And in those cases, again, we use the same medication we use for acne to help resolve that, and then adjust the dose at the next pellet insertion. So these are some of the things that come up, things that we discuss when we're discussing, do you want to do pellets or other forms? And again, if you're a man, pellets are going to be the only form that we do at Path. And for women, we have some other modalities that we consider, but our preference is pellets, just for all the reasons that we discussed. So let's talk about what you do now if you are interested in finding out whether or not you need to be on hormones at all, and then to have a discussion with one of our practitioners about what method is right for you. We do a consultation That initial consultation will allow us to get your labs, review those labs, and during that consultation, we'll give you a direction on what path we think you should take. If you should be going towards creams versus pellets versus patches, or maybe if you need a different option altogether, whether or not you need to do hormones or if you need to do medical weight loss, we'll discuss all of that during that appointment. And so that's how you get started to work with us. In addition, we have many other opportunities for you to obtain. You can scan this QR code or text pellets to this number here, 510-319-1007, and you'll get a link to a video that goes into some more depth about pellets. So I hope that this talk was informative. If at the end of it you feel like you have a better sense of whether or not pellets might be the right choice for you. And I will see you guys next Tuesday, Hormone Talk. Thank you guys for joining, and we'll talk to you soon.